All right, welcome back, guys. I wanted to thank you guys for all coming out. I reached out to Dr. Zeller for this show because I just thought the whole story is really interesting, to be honest with you. And I'm always looking for things that are interesting to me and what I think might be interesting to others. And I'm kind of interested in getting to know her a little bit today and getting to know her story. So Dr. Zeller, right?
Yes, you can call me Stephanie, but yes.
Stephanie. All right, cool. You can call me Serve. I think some patients think when I say, "Oh, just call me Serve" or whatever, they think I say Sir, and they're probably thinking, "What a douche," you know? No, it's Serve, like serve me beans. But yeah, so you are by education, doctor, dentist, prosthodontist, right? So you always wanted to be a dentist. Like, what happened there?
Yeah, my dad's an oral surgeon.
Oh, I didn't know that.
Yeah, so
Very
I grew
nice.
up around dentistry and thought about doing a few different things. Interestingly, thought about becoming a psychologist, but then ended up going the dental route. And yeah, went to dental school. And then I practiced general dentistry for a few years. And then I did a pros residency at Baylor in Dallas.
Wow. So you really thought about it. I mean, you're a dental family, but my family, none of us were dentists. My mom was a nurse, but nothing else medical. I've always wanted to be a dentist since I can remember, like fourth grade even. Like, oh, I'm going to be a dentist. And I always thought I was going to do it. Ended up getting into dental school. And when I got into dental school, I was like, it's okay. It wasn't like great. And then like my second year I did, they make you go through all the rotations, and I did the peri or whatever, and that was terrible. And I did oral surgery, and I was like, this is cool. And so I'm like, yeah, I'm going to be an oral surgeon. This is like my second year at dental school. And so from then on, I was like, yeah, I'm going to try to be an oral surgeon. And so like I did everything I could to do that, and I ended up doing that. And so that's kind of how I got into it. I didn't even know what the specialties were when I got into dental school. I had no idea. I just like dentist, but I didn't really even know what that was. But you grew up in a family essentially that had a dental background. Do you think that had something to do with you picking dentistry?
Oh, I'm sure.
Yeah, like psychologically
100%.
or something, right?
Yeah, I think, subconsciously, I think that it just seemed like I think honestly, a lot of it was like a safe path. It was like predictable. It seemed like something I was interested in. Dentistry is so unique. I don't know if you could really know what it's like until you start dental school.
I didn't. I had no idea. I just
Yeah.
thought dentist is cool. They do well, whatever at the time. I didn't know it was all like wax ups, using the oil from your face to shine your wax up. Pre-clean. Like it was just like, what is that? What the hell's going on here? Like borrowing like your friend's pantyhose to shine your wax ups. Like that's a thing if you don't know. But yeah, so that's how I got into it. It's not easy to get into dental school. I didn't want to be an MD, doctor, nothing. I just wanted to go in dental school. But I ended up doing my MD through residency, just different because I chose oral surgery. So you got into dental school, and did you love it? Like when you were in it, you're like, this is sweet.
No.
Yeah. You're kind of like me. I was like, what is this?
No, but I thought, well, yeah, dental school's hard. Like like no one loves it. No one's gonna love it. I'll probably love it later. And honestly, I don't think I even thought about it. I don't think I was really considering like, do I love this? I think I just thought, this is my path. This is what I'm doing.
But yeah, so you got in dental school like I did, and you were kind of dismayed like I was. For me, I found a different calling there. I was like, oh, I like this better. For you, it was like, oh, this is all right. I mean, it's not great. It is what it is. I'm in the Seattle area, and I think you were here before, right? You were a prosthodontist.
Yes.
I remember you were doing lectures, and I remember seeing like CE things you were doing, like all sorts, like you were doing it at a high level. Like you weren't just doing your work, going clocking in, clocking out. You were like still in your profession. You were going above and beyond because not only you're a dentist, but you're actually a prosthodontist.
Right.
Right? So I mean, even with the way you felt about it, you're really doing it at an above and beyond level.
Well, it's not like when I was in dental school, I hated it, but it was just kind of whatever, right? And then I got out, I started practicing. I lived in a couple different states, worked at several different practices. So I think I was looking to make it fun and interesting. So I started taking a lot of CE, which a lot of people do to like spice it up and be more passionate about what they're doing. And
Yeah.
all of my money was going to CE. And then eventually I realized that pros sounded really interesting to me. And I've always been someone that wants to achieve mastery. Like I like getting into flow states and enjoying what I do. And so I thought, well, maybe that's a path because pros seems kind of interesting to me. So after, I think I practiced general dentistry for 4 years, took a ton of CE, studied the business side of it, etc. And then I applied to pros and started my pros residency. I did like that quite a bit more. than the general dentistry that I was doing. And in my pros residency, that I had a big focus on, I did research in digital dentistry, and the thing I really focused on was really big cases, surgical cases. I teamed up with oral surgery a lot and technology. And then when I graduated 3 years later, I knew so much about those things because I had really honed my residency on those things. So implant companies started asking me to speak. And then I started speaking a lot, like sometimes upwards of 10 times a month.
Yeah, I remember seeing your stuff pop up on certain socials or whatever it was, just Dr. Zeller, like a lot of stuff going. I'm like, wow. Because I think we had a mutual friend, like rep at the time. He had mentioned, hey, have you met Dr. Zeller yet? I'm like, no, I haven't. Because I was starting to do like full arch stuff back then and all sorts of stuff too. And he's like, yeah, you should meet her. She's doing a lot of cool stuff. I'm like, yeah, but we never had the chance to connect back then either. But then before you know it, you were gone. I was like, like, where'd she go?
Yeah.
But so we'll get into that in a second too. But yeah, you were really doing it at a high level. So I'm not trying to say that, someone that doesn't like the path they're on, you can still do it at a very high level, but maybe your heart isn't in it. In
Well,
the same
yeah,
way,
I didn't
or is
know
what it
that.
was? Yeah.
I didn't know that at first. I mean, that's the confusing thing about, I think, our careers is we find aspects of what we do like. I mean, there was a lot about what I was doing that I did like. I really enjoyed the teaching aspect of what I was doing.
Yeah,
I
like
created a podcast in dentistry. I was really active on my Instagram account that I had for dentistry. So there was all of these aspects of what I was doing that I did enjoy. And I was just going as fast as I could up that mountain to, I think looking back, find the feeling I was looking for. Because I think I kept thinking, okay, once I hit this amount of success or once this happens, I'm going to feel overjoyed and really lit up. And that quote, if you love what you do, you'll never work a day in your life.
Yeah, I get it. I mean, I get the quote. I haven't felt that way just yet, but I get it.
Yeah, I thought that once I hit a certain level, I would feel that. I was like, okay, I just have to get to a certain level and then I'll feel that. Because especially in dentistry, it's kind of interesting. I think what a lot of people look at as the pinnacle in dentistry is someone that's lecturing and someone that's kind of well known and working at such a high level. And so I was like, that's what I was running towards, is once I get to this really high level, I'm going to feel this way. And so I didn't hate what I was doing, but it's like something was off. I didn't feel the way that I thought I would feel once I got to that level.
And I think you're not alone in that. I mean, because I've felt that, and I know other people do, and they just do it because they're stuck. Like, you go through graduate school. That's a lot of expense for a lot of people, that, maybe don't have the means to pay for it. They're getting loans, or, even if their parents pay for it, that's still a big burden for people to do. And then you feel like you can't just get out of that. Like, in your mind, you feel that way. Maybe you can't, right? But you just feel like you can't. You put so much into it. What are people going to think? That's what I would think. Like, what are other people going to say? Like, like they're going to think I'm crazy. They're going to think like, why would you, waste your life that way? But in reality, it's probably not that way, right?
Yeah. And I mean, I didn't have any of my schooling paid for me. Like at the time,
yeah,
I had a lot of loans, and
so
I put so much time, energy, money, effort. Like, yeah. And then, well, do you want me to tell you what actually happened?
Yeah, I'm really curious. I really want to know.
Yeah, so I kept kind of running up that proverbial mountain to try and find. I didn't know I was doing this at the time. And I think that's really important to say because no one knows. Yeah, like no one knows what they're actually going for when you're spending, tens of thousands of dollars on CE and all the things. You don't really know what it is you're searching for. You're just told like, do this, hire the coach for your office and just get better at running business and know more skills. And then you're going to feel the way you want. And I think it's actually really pervasive in CE, and there's nothing wrong with CE, but a lot of the people that run CE, and I ran CE, so
yeah, I know.
I'm not saying CE is bad, but a lot of people that run it kind of, there's this, they kind of actually say, if you take this, you'll be happier and you'll enjoy what you're doing more. And so I did that, even went back to school and everything. And then what ended up happening was I ended up doing this speaking engagement that it was a little bit different from something I was normally doing. And it took a lot of courage for me to do it. And I remember I came back to my office the next week. I just sat down at my desk and I had this moment where I was like, oh my gosh, I've reached the mountaintop of everything I wanted to do. in this industry.
Yeah, you did. You're a super specialist, really.
Yeah. And I don't feel the way I thought I was going to feel. And at that point, it felt really devastating because I realized there was almost no other mountaintop for me to climb. And I didn't know what to do. Like at that point, it didn't even cross my mind to leave dentistry. I just didn't know what to do. And I had kind of like a little bit of a mental breakdown around that because I was just like, I mean, it's kind of like once you see it, you can't unsee it. But I had no idea where to go with that. And so then that's where I started this path of trying to figure that out, which was a excruciating, long, tedious path that I literally had no one to talk to about it because this was back in 2018. And I feel like people now are a little bit more vocal about kind of mental health and also just people that are unhappy in dentistry are talking about it more. But back then, like pre-COVID.
Yeah, pre-COVID. You have to talk about COVID before and after now.
Yeah. Well, I think it opened people up more to like examining their life. You know what I mean? Whereas beforehand, no one was really talking about it. And especially in my case where, like you said, I had specialized and I had spent all this time, energy, money. And then to tell people like at my level that I wasn't happy, people didn't even know how to respond to me. It's like, but you're the person I'm trying to be like. And if you're unhappy, it was very triggering for other people to hear that I was unhappy.
Yeah, because you're not only at a high level, I know there's lots of people that watch or listen that aren't dentists, but a prosthodontist is essentially, and I tell patients have no idea what that is. Sometimes I refer to a prosthodontist. I'm like, they're like a super dentist in a way, but they've done like 3 extra years of school after dental school to learn not only the basics, but the really advanced cases so they can pretty much do it all. And I know some prosthodontists specialize in certain things and that's fine, but for the most part, it's a lot more, complicated cases. You're getting dumped on by other dentists for a lot of mess ups and trying to fix this and, all that kind of stuff. So you're at the peak, but not only that, you're also teaching people. You're doing things and you're, trying to teach others at the same time. So you got a lot going on.
Yeah. Yeah, so I wasn't sure what my path was, but I started after a few months of reflecting internally. I started wondering if it was maybe something outside of dentistry. But the thing that I didn't want to do is go start on another career path and then end up in the same position where I was at the top of a mountain. And
life is short.
Yeah. And well, I didn't know how I ended up in this position in the first place. Like, how did I get into a career that I thought was going to give me everything I wanted? That I thought was going to give me that if you love what you do, you'll never work a day in your life. And then it didn't work out. How do I know I won't just do the same thing again if I leave? I had a history of trauma in my childhood and went through a lot of therapy. So I knew in a way that happiness was kind of an inside job, but I hadn't really understood what that meant or how to pursue that. So I started essentially going on a long internal journey to figure out who I was, what I really wanted. In order to do that, I had to work with a lot of different practitioners. I studied with a lot of people. I learned a lot of techniques around like rewiring my mind and body, rewiring my nervous system. There was just like so much I had to do to be happy on the inside.
Is this on your own or did you take courses, read books, like all the things?
I took some courses, worked with some practitioners.
Yeah.
And then over time, I started developing my own methods to do these things. And that started working. I started feeling happy internally. And it was kind of like when I started doing that, it was like a veil lifted. And I started getting real clarity around why I wasn't happy in dentistry and what I could do differently and how to pursue something that I would be happy in. But the mistake I see people making, because people come to me all the time now with help with this, is that they don't do that work first. And then they just pursue something else. And then they end up repeating the same cycle again and again and again.
Right. It's almost like lip service. You're in a bad relationship, as an example, with someone.
Yes.
And they just keep saying, this time it's going to be different. I won't do that again. I won't do that again. But it's like lip service. It's not, they didn't do the work to even fix that problem. Like they can tell you and they can be good for a while, but they just kind of go back to their old habits and never did the work. That happens to a lot of people, and it's similar in profession. I think it's the same thing.
Yes, that's a perfect metaphor. It's not even a metaphor. Yeah, it's a perfect example that like people end up repeating relationship patterns with different people. It's like this, they keep dating the same kind of person, right?
Yeah.
So that's what I didn't want to do. And yeah, so anyways, I ended up along that path. I realized that something that I was really good at and had always been really good at is coaching other people. In fact, it's something that I had been doing anyways without being paid for like my whole life. And it was kind of like it was right there in front of me the whole time, but I was so naturally good at it. I didn't realize it was a gift. So people started coming to me with their problems in their career because they knew that I was dissatisfied with mine, and I started coaching them. And then over time, it developed into very specific programs for people to help them essentially do what I had done. I mean, I took all of the tools that I had developed, all of the methods, and then I created courses. And now I help people do what I did. And the interesting thing is, because the first part of it has to be an inside job, like figuring out what's going on
Totally.
inside of
I
me.
120% agree with that. Like if
Yeah,
you don't do the work, you're not going to feel different. You're not going to change.
right. And because of that, some of the people that come to me and that are dissatisfied in their career, once they do that inner work, they end up not leaving their career because they're able to make changes within their career that actually give them the
Right. And maybe
happiness that
that
they're
was the
looking
big
for.
problem. Like they weren't, there's other things in their life besides work. There's family, there's, other things going on. But yeah, you're right. If you don't actually do that inner work, and I don't think for a lot of people, let's just say, oh, I go to therapy. I don't know how you feel about that. I mean, therapy is great. I just feel like that's still not enough. Like you can't just say I go to a therapy session and that's helping me. I feel like
Yeah.
that's like just one of the things. Like like for a lot,
Yeah.
like you got to do a lot more than that.
Well, I'm
You
so
know?
glad you mentioned that because actually, when I hit this point in my career, I was in therapy every week. I was meditating every day. I worked out. I was doing all the things that people say you should do to have like mental health
Yeah.
and happiness, and that wasn't enough. And
No.
and the thing is that therapy is not targeted towards your career. I mean, you can go into therapy and say like, "Oh, I had a hard day at work," but it's not targeted to help you figure out what will actually give you sustainable happiness in your career.
I'm not bagging on therapy. It's great. I don't think it's
Oh yeah, for
enough
sure.
for
Yeah.
a lot of these things. And sometimes it's people are like, oh, I can just pay somebody $200 an hour or whatever they charge for therapy. And it makes them feel like they're doing something. But then they leave therapy and they don't really think about it again until their next session. Like
Right.
it's not doing the work, right? There's no homework. There's no like other stuff going on that you need to do. In my opinion,
Right.
I did a lot of that too. Like I went through some period there in like 2014, 15, where I had a lot of personal stuff going on, and I did go to therapy. I did all these things. But then I took courses. I did like a 12-week like inner self course. I did like on my own, had a stress management course. Like it was another 9 weeks with homework and like group exercise. It was like a lot of
Yes,
work.
exactly.
This is all
Yeah.
in person at the time, and so yeah, before COVID, in person stuff. And then I think that really helped. Not only that, I read books. I just kind of slowed my life down in ways, and I felt all that together really helped. And I feel like now I can manage stress a lot differently. So there's a lot of benefits to that. So I totally agree with what you're saying. As far as
Yeah.
doing the work. So you're helping people do the work.
That's exactly what I'm doing. Yeah. I
Yeah.
mean, I've created a method based on what I did to find that happiness, not just inner happiness, but also now my job fully is if you love what you do, you'll never work a day in your life. And I think it's hard for people to
That would be
believe
so
that that's
nice.
possible. Yeah. I mean, I tell people that
Sign me up.
and they're,
How do we sign up for your course?
yeah.
I'll put it up there. I'll put it up there.
That is
Yeah.
literally the goal of my course is to help people start experiencing that. And I think
Yeah.
and in talking, I think what happens is that people don't experience that, and because they haven't experienced it and maybe they don't know anyone else that has, they make it wrong. They say like, well, that's not possible. Like that's ridiculous. No one loves their job that much. But you can. Like I do. My job actually energizes me, which is like it lights me up so much. It
I want
energizes me. I
that.
feel so good.
Are your
And there's
courses
this,
virtual or are they like in
yes, they're all
person?
virtual. Yeah. So
Okay.
the main course for careers, it's called Your Life's Work, and it's a 10-month course, and it's using my method, and it's exactly what you just said in terms of there's coursework. There's like a lot of coursework. I
Yeah,
mean,
you
this
need
is,
that. Like I had
yeah.
no idea. So before we started talking about this, I knew a little bit of what you do. I don't know, like I learned more information just talking just now about it.
Yeah.
But I totally agree with, I was coming into this thinking like, therapy is not enough. You need to do a lot more than that. And like you said before, like you're not trying to get people out of their profession necessarily. Like you're just trying to figure out what's going on, how to make them
Right.
happier, and whether they choose to stay in their profession after that, that's totally up to them of how they feel. So we're not saying get out of dentistry. We're saying let's figure this out. Let's slow down,
Right.
look at the bigger picture and figure out, where this is coming from and how to actually fix it.
100%. I mean, and I would say about 70% of my clients that go through this course are dentists.
That's awesome.
Yeah. And then there's
Don't they have the highest
attorneys.
suicide rate? That was something that's been quoted for like 50 years,
Yeah,
I
I've heard
guess.
that.
I
Yeah.
don't know.
I mean, yeah, my
Yeah.
course is built for professionals that
Yeah.
have spent so much time, money, energy in their career that they're self identified as that thing. It's like,
Yeah.
I'm a dentist. I don't know what I would be if I wasn't that. And then for
I
people
know.
that are listening that aren't dentists, like I also have attorneys, entrepreneurs, CEOs, that kind of thing go through this course. But yeah, like I would say at least 80% of the dentists that go through don't leave their career and are way happier and are able to restructure their career in a way that they then do have sustainable happiness. And they aren't just chasing it through like a CE course or, just trying the latest and greatest thing that they think is going to shift things for them.
You're in a rat race. Like you're getting all
Yeah.
this bombarded with all these new techniques. And you're like, so and so is doing it. My competition's doing it. Someone's doing it. I
Yeah.
got to do it, whether you want to do it or not. It's almost like you almost feel like you got to do this stuff. Maybe you want to do just bread and butter dentistry. Maybe you just want to do removables, dentures or something. But everyone else is doing everything else, and so you feel like you got to do it too. And I
Yeah.
think people get trapped in those little scenarios. Oral surgeons too.
Yeah.
I know some surgeons that are like, they don't even do implants anymore. They're like, you know what? I decided it wasn't for me. Like, I'll do some here and there, but I'd rather just do expose and bond surgeries or wisdom teeth or something else. And they found that balance for them, rather than trying to compete and trying to keep up with everyone else. So I think they've figured that out too. But yeah, that people stay in their careers most of the time, but they figure stuff out better, right?
Right. Yeah. And again, happiness really is an inside job, and so much of your happiness can come from the inside and from knowing how to just be happy on your own without trying to manufacture happiness through the things that you're doing or the things that you're getting in the world. So if you can just be happy, like have a baseline of happiness, it changes everything you're doing throughout the day in your career and everything, because then you don't have to be in that race. You aren't comparing yourself so much to other people.
Yeah, that's where you get stuck sometimes, like, thinking you need to do that or that's just how you do it.
Yeah.
I agree with that. I've been performing full arch dental implant surgery since 2012. I started back then with Nobel implants and I continue to use them today. Getting consistent results over time and seeing these restorations in function over that length of time has basically strengthened my use of the product. There's over 100 implant systems out there. I just choose the one that's been the most consistent for me. Off topic, there was a dental implant meeting in Seattle this week, and I went to it. I didn't even go to the lectures. I just went and just kind of talked to people and on the convention floor and things like that. And that made me happy. Like I was
Yeah.
not wanting to sit in any lectures, at this stage of the game. Like I feel like I know what I know and I'm good. I learn things. I for sure learn new things, but there's so many more ways to learn these things than sitting inside a CE course now. But so leading up to this, I had a question for you. What is like burnout? Like, have you heard of people say like in your courses, I feel burned out? Or
Yeah.
is that like a thing like that you help with, or like what is it?
100%. Yeah. Yeah. I mean, I
Sometimes
would
I
say
feel like I'm burned out, but I don't even know exactly what that is.
yeah, most people that come to me do have some degree of burnout. Well, burnout is essentially being over fatigued and not feeling like you have the motivation and the drive to continue doing what it is that you're doing.
Yeah.
But there's some very specific causes for burnout. And the interesting thing is I find that most people don't know what causes it. So there's a constant fear around it. I honestly think the number one cause of burnout is doing things you don't want to be doing.
I think you're right. And some people think burnout is fixed by like taking like a week-long vacation somewhere. There's pluses to that, giving your mind a rest. I agree with all that stuff. But then you get back into what you're doing. When you're working in dentistry or whatever, and you take a week or two off and you come back, it's like a crap show. Like it's usually like
Yeah.
even more work to calculate, like that cancels out almost like the vacation you had as far as your mental, that's for me. I'm like, oh man, what, this patient got infected when I was gone. There's this list, like something going on. So burnout
Yeah.
is a thing. I feel like I'm burnt out sometimes. Like I do feel that way.
And that doesn't happen the whole phrase again, if you love what you do, you'll never work a day in your life.
Yeah, I
If
know.
you love it that much, you
Sounds so
won't
easy.
have burnout. Yeah. And I mean, there are other things that play into that, such as making sure, a lot of people are addicted to work and there's workaholic tendencies, and that's for a reason. And that's something we address in my course to alleviate you of feeling like you have to work all the time. But for the most part, I mean, probably 95% of cases, the reason people reach burnout is because they're doing specific things in their work that they think they have to be doing that are completely mentally, emotionally, energetically exhausting them. And if you keep doing them again and again and again, your body's going to let you know, like, hey, it's not what we should be doing. And the thing is that we convince ourselves that that's wrong, that we should ignore our body, that there's something wrong with us, that we can't push through this exhaustion. And so then people keep pushing, doing more things they don't like. And then that's when they usually have like a total breakdown.
Yeah.
And they have to take time off.
Right. Right. Because they physically can't do stuff anymore, until they fix that or get that addressed. So how'd you know this was like the path for you? Like when you said you started doing it on the side while you were, being a prosthodontist, but then you realized that this is what you like to do, and you had some life events or something that happened, I'm sure. And then finally you're like, you know what? What was it like your last week of, a prosthodontist? Do you remember anything about that?
Well,
Were you happy, sad?
Well, when I realized, okay, something's off in my career, I actually started changing things right then. I started working less. So I started doing less clinical dentistry and more speaking. So there was like a good year where all my money came in from speaking. And then I wasn't really doing much clinical dentistry at all. I would say that the reason that I knew that this new path was for me was because it lit me up, because I was so excited to do it. There was this thing in dentistry where overall, like I said, it's not like I hated what I was doing. There would be these moments where before I would walk in to see a patient, it was like I didn't really want to go in there. Like it was a subtle, almost imperceptible, but it was just this subtle, like I'd kind of rather not. I'd kind of rather have the day off, or I'd kind of rather do one of these creative projects I'm doing. And I noticed in my new path of like helping people be happy and having a career that really lit them up, like I never had that. I was just excited to get on a call with them. And that's when I knew like, this is the new thing for me. So as I transitioned, it was, yes, exactly. I mean, can you imagine work being so fun?
So I know you're going to finish your point, but I can now, because when I didn't start doing social media stuff until after COVID. So before COVID, after COVID, I was doing online or live lectures here and there and things like that. That was fine. But I'm like, let me just start showing stuff on Instagram or whatever. And other people have been doing it years before me, but I'm like, and then it just kind of like, I had fun with it. I'm like, this is way more fun than going to work, and then like, it is work because I'm showing what I do as work a lot of the time. I still have to work to show it. But now branching off into this space, it's even more fun. Like I'm learning way more stuff that, I wouldn't have never known. Meeting new people, and I really enjoy it. Like I'm having a lot of fun. It's a low-paying, fun job right now, but it's probably in that transition phase that you were in, it sounds like. Yeah. Like you were figuring out like what's fun for me, and then I like this better, honestly.
Right.
Like, I don't like being tied to a location. I've done it for 17 years now. It's great. It has its benefits, but it's not. At this stage in the game, like for me, it's like, it'd be nice to be more free. I think my mind would be more free. Does that make sense?
Yeah, for sure. I mean, that's what I enjoy now.
Yeah, I mean, there's something about tied to a physical space that on some level affects me, I think. I have to go to this office. I have to go.
Yeah.
And some people, you can't get out of that. But at this point, I'm like, this is fun for me. I'm like, I was looking forward to this, like learning about it, because I have some of the same views and thoughts on it. And so I was really like curious about it. And that's what's fun for me. I can get to, interact with people that I would normally never meet or never interact with, and you do the same thing with all these professionals, right?
Yes.
They're coming to you.
Right.
And your goal is to help them figure stuff out.
Right.
And so like, what have you learned about yourself and like, in doing this in the last few years? That's like a loaded open-end question, I know.
Well, I think that the things that I started to enjoy in dentistry, they were showing me, it's almost like they were breadcrumbs to what I was really meant to do. And so I've found that I'm really good at coaching people. I'm really good at knowing what will make them happy and helping them get there. I mean, at this point, I'm a personal transformation expert. So I know I can quickly assess where somebody's at on their path and exactly what they need to do to get to the next level. And by next level, I always mean next level of happiness. Yeah. And
not
next
necessarily
level
like CE, like next level of, dental implants or something. You're working on their inner stuff.
Yes, which
you have to do.
Which does translate into success. Like almost everyone that goes through my course makes more money and has more success by the time they're done. And that's because like when we're super happy, we're more magnetic. We attract more opportunities.
Yeah.
We tend to be more successful when we're lit up versus when we like are in a hustle and grind, forcing ourselves to do things we don't like. We're not even happy. Like people can feel the energy of people being
They
unhappy.
totally can. They can, like, if you're charming, let's say, like that affects
Yes.
people
Right.
versus, monotone and just, like the Seattle freeze people, it's just, there's a whole difference there. Right.
Yes.
But yeah, I agree with that. And have you ever heard of, and you probably have, NLP or neuro linguistic
Yes, I'm
programming?
trained in NLP. So
Are
that's
you
part of,
really? Oh
yeah,
my
that's
God.
part of
Okay.
the technique that I use.
Okay. So neuro NLP, I read my first book on NLP probably like 14 years ago. And it was this guy, I think it was Navarro. He was an FBI interrogator or something. And he had this book, I think it's called, and I could Google it, but What Every Body is Saying, like your body, the way you
Yes.
talk to people, the way you're standing, your hips position, your feet. Like there's all these little subtle things, your micro gestures, things like that. I read it and I was like, whoa, I read it. The only reason I was reading those books is because I'm a specialist. So I was like, a patient sees me for a brief amount of time for a procedure that may or may not involve sedation or high risk. I have to like gain their trust in that short amount of time for a consultation and, figure out what they want to do. And so
Yeah.
like, I really got benefit out of it because I felt like, I'm reading the way that they're talking to me. When I look at them, when they're talking, I make eye contact with them. Even if I'm writing something, I'll like look at them and stop. Like little things that you're doing that you may not even know you're doing,
Right.
affects all that little interaction. So NLP is I think it's a huge thing. And some people are just normally just good at it without even knowing what it is.
Yeah.
And some people have to read about it and learn things, right?
Yeah. Yeah. Yes, I learned a lot of techniques to help people in my courses, and that was one. Like hypnosis is another, things like that.
Yeah.
Because so much of our lives, of how we feel, of what we're attracting, has to do with our energy and how we feel on the inside. Yeah.
I agree. Yeah, NLP, I love that stuff. Like it all
Yeah.
makes sense to me. And some people are just naturally good at it. They have a charisma, have a way of speaking and, interacting with people. And some people have to work at it, and some people are never going to be good at it.
Yeah.
It's just the way they are. They don't want to fix things. But yeah, that's awesome that you do that. I didn't know that.
Yeah.
Good for
Yeah.
you.
Yeah. Well, that's part of so much of the reason we feel the way we feel is because of our subconscious programming. So, for instance, like if most people have a belief that work should be hard, and if you have a belief that work should be hard, you're going to prove that belief every single day because that's how you think the world works. And if somebody tells you, well, work doesn't have to be hard, you're not going to believe it because that's not your experience. When you can start to change your beliefs on a subconscious level, like for instance, changing the belief from work is hard to work can be easy and work can feel really good and work can make me a lot of money and work can feel like flow, then all of a sudden you can start creating that in your life. So that's a lot of what I help people do is change those underlying beliefs about what work is.
Awesome. So you have courses, right? We
Yeah.
talked about them briefly, and I'll put them up on the screen. What's the best way people can reach out to you for this sort of thing?
Well, my website is thetransformationschool.com, and my main course to really create big transformative change in your life is called Your Life's Work, and you can find that at thetransformationschool.com. You essentially just apply for it, and then you can enroll. And then I also have a free course, which you're going to put in the show notes, but you can also find that at thetransformationschool.com as well. And then you can follow me on Instagram or reach out to me on Instagram at Stephanie Zeller Speaks.
Awesome. Yeah, I'll put all that stuff up as
Yeah.
well. But I want to really thank you for coming out on
Thank you so
on your
much.
weekend, hanging out virtually. And I think you're somewhere really, really sunny right now, right?
Austin.
You're not in Seattle anymore, so
No, moved from Seattle to LA and now Austin.
how do you like it there?
I love it.
Yeah?
Yeah.
That's nice. That's nice. I've never made it out to Austin. I've only been to Dallas twice, but that's about it.
Yeah.
But good. I really appreciate you coming on. And I was really interested, like I said, to talk to you and learn more about this stuff. And if I'm interested, and I'm pretty sure a lot of people are, because that's how we think. And just having talked to people over the years, like they're in that same situation. They just feel like they can't do anything else.
Yeah.
Like there's nothing else they can do. And we're not saying that you have to leave your career to be happy, because you're
Right.
saying 80% of people really don't do that. They just figure it out. And therapy is, in my opinion, not enough. You need to do work. And so you're
Yeah.
part of the algorithm to do the work. Right.
Yeah.
And you're a living example, really. So I think that helps.
Yes, exactly.
So,
Yeah. Thank you so much.
You're welcome. Thanks, Stephanie. All right. Bye.